Hey, what's up, guys? Today I'm going to talk about cognitive behavioral therapy. I am in my car, as you can tell. That's because I filmed this a while ago and ran into some issues. So here we are. All right, so some key players here, Aaron Beck and Albert Ellis. Albert Ellis is, of course, the founder of Rational Emotive Behavioral Therapy, which sort of introduced the idea of irrational thoughts, irrational beliefs, and how they affect our behaviors. And then Aaron Beck is the founder of cognitive behavioral therapy as it is today. So this form of therapy is goal-oriented. It's toward an adjustment in thinking and behavior through kind of teaching and learning. So a cognitive behavioral therapist is a little bit more directive than maybe a person-centered therapist would be. And that's because the therapist is finding the flaws in the client's logic and able to point those out in a super non-confrontational way. These therapeutic relationships are structured and time sensitive, so you're not going to see somebody necessarily employing cognitive behavioral therapy over a long term. It's more of maybe a 6 to 12 weeks. Here's our goal, and sort of achieve that. It's very focused on the present. Cognitive behavioral therapy is not necessarily concerned with past trauma or childhood development, things like that. So some key terms here to keep in mind would be cognitive distortions, which is sort of these irrational beliefs or faulty ideas that cause maladaptive behaviors and cause sort of emotional disturbance. Cognitive restructuring, which is sort of that teaching that the therapist does to fix those irrational beliefs. And then core beliefs, which are sort of the things that we believe about ourselves and about the world that shape how we live. So the first article here is about orthopedic surgery. So, you break a bone, you get orthopedic surgery. And this is pre-operation. So 34 of these patients received cognitive behavioral therapy before surgery, while the other half received standard care and psychological counseling from the medical staff. So psychological counseling not meaning that they are certified as mental health counselors, but it's sort of just the training that nurses are given to give to patients. So the things that we're measuring for here were sleep quality, anxiety, and pain reception. Not pain reception from the standpoint of feeling more pain, but rather how pain reception can be sort of amplified by higher anxiety. So higher anxiety will amplify pain reception and also decrease sleep quality. And the collection of these things was called self-management in this research study. So they used a mixture of certified skills like the Athens Insomnia Scale and then self-assessments for the anxiety to test these things. They did it before surgery, and they compared the two groups. So patients from both modalities experienced increased self-management. However, the cognitive behavioral therapy patients were experiencing much higher growth, even 2 to 3 times better improvements in all areas. So the second article is a meta-analysis, so research on prior research of 22 articles for cognitive behavioral therapy for Parkinson's patients. So the quality of life and cognition for these patients receiving CBT versus receiving some of these other modes of treatment was measured. Some of the conclusions that they drew from this was that CBT proved to be much more effective than these other treatments in terms of treating anxiety and depression specifically, and Parkinson's patients saw an improved quality of life following CBT. And then it also amplified cognition and mental health, which minimizes depressive symptoms. So the conclusion basically that they drew was that CBT is ineffective and should be a primary method of mental health care for Parkinson's disease patients. In the third article, CBT was coupled with exercise to treat university students. These two forms of therapy are normally separated. Albert Ellis specifically mentioned, as I'll talk about soon, that he didn't see exercise as useful unless it was coupled with restructuring of thoughts. So normally these aren't put together. So some students at a university wanted to put them together and see if it was different than treatment as usual. So these 16 students had depression and mild anxiety symptoms. So the half of them were given CBT with exercise, while the other ones received treatment as usual. So this went on for 2 weeks. The first week, the first group all together had a session every day, followed by 30 minutes of running. And the second week, it was just exercise. So they cut out CBT entirely for that second week. They ran into some feasibility issues because, like it says, there was only 16 students that did it. However, they were able to find that a higher rate of reduction of anxiety and depression symptoms was found in those who did CBT plus exercise versus those doing treatment as usual. So the primary source, Albert Ellis, in his writing, How You Create Your Feelings, he talks about basically where emotions come from, and we know that they're extremely complex. We don't really understand them fully. Maybe we never really will. They have many potential origins or geneses. So they could come from the physiological, the sensory, and the cognitive. So, there are smells that elicit emotions. There are physical sensations that elicit emotions. There are thoughts that elicit emotions. And you may not know which is causing whatever particular emotion you're experiencing in that moment. So Albert Ellis, the gist of what he was trying to get at is that without the treatment at the thought level, emotions are very difficult to regulate. So, if you just work out, it will be effective in the short term. It will be effective in making your mood better, but it's not necessarily going to fix the problem, because he believes that the root of the problem is often our faulty thinking. So the same goes for medications. They're great for short-term control of emotions, but for long-term results, people must change their thinking patterns. And that's it.